use the whole reading. Even though he doesn't have a seizure, it will look like a seizure. So this is what an EEG technician does. He has a bunch of filters on the top and he can play with it. So for example, the high frequency filter. So generally in most hospitals you set it at 70 Hertz. But suppose the patient has some movement and now you see spikes, but you want to know if this is actually a seizure activity or it is normal. You change the filter to maybe like 30. You remove everything above 40 and then you can get a clear image of just the neuronal firing. So this is what a technician does. He plays around with the filters, the frequency filters, the time frame, the sensitivity to get an accurate reading. And this is also again why we are not taught this in medical school. It's very complex how to change it, and you need like years of experience to know how. Like I know like what movement he did, so what frequency I need to remove to see the actual wave. Right. So this is our first normal EEG, and it's normal. Oh, now it's visible on the top. The filters. Can you guys see it now? So LFF is low frequency, HFF is high frequency, notch, sensitivity, time based. You just press the arrow, you can change the setting, and then you can do things better. Alright, so look at the left hand side. So again, a quick test. Which part of the brain is this? Are these four electrodes for? So when you see there are two electrodes here, right? Because I didn't mention it before because it becomes way too complex, like what is bipolar configurations and all that. But all you need to know is the only thing you're reading is the end numbers. So 7771, it's odd. So which part of the brain? That's again 73331. Left. This is center. 4442. 8882. Right. So we know the first half of an EEG is showing the left side of the brain, and the bottom half is talking about the right side of the brain. Alright, so now let's look. So what's the first step to read an EEG? You guys remember? Occipital. Okay, so where is the occipital? Here? Or 2 or 1? Anything. Okay, so let's count. I marked the box that I want you guys to count. Is it visible or do you guys want me to zoom in? Yeah. So yeah, it was 11. So was it clear why it's 11 that you guys will count it? Right. So it's 11. So does he have which wave does he have? So it's good, right? So we know he has asked. So he has a posterior dominant area. That's your first step done. What's the next thing I told you guys? We look for reactivity and whether the patient has an open eye or a closed eye. You see this weird big like a mountain over here. This basically indicates the patient has opened his eye at this point. You want to know how the EEG technician confirms this? After the patient has opened an eye, we're looking at the reading after that. Does he have an alpha wave after that? What did I tell you? Looks a lot, I'm but this looks like a beta wave. So again, when is beta seen? When your eyes are open and you're active. So not sure it makes sense, right? So you know the patient's eyes is closed, he opened his eyes, and now you see a beta. Does that make sense? There's no alpha wave. Okay, now you see this down thing, right? This is the patient closing his eyes again. If you're wondering why the patient is opening and closing his eyes, it's because we all playing. That's why. So he opens his eyes, you see the beta, he closes his eyes, and now again he's like, wait, this is the better image. So he closes his eyes, can you count the waves here? Does this look less than 30? 1, 2, 6. It's 10. Do you guys get what I said or does it? Yeah. So see, eyes were open, the wave shifted to beta. He closed his eyes because it's gone down, and now again back to alpha. So this is a normal EEG pattern. Now this is another very interesting thing over here, and it gets a bit complex, but you know what this will mean. So you guys know now if it goes up, eyes are open. If it's down, eyes are closed. What is this? Any guesses? It has something to do with the eyes. Maybe? No. So I'll give you like a mnemonic or a tip. Whenever you see something like this and you think you can fit a circle or an eyeball in it, right? All this means is there is horizontal eye movement, like the patient's look left or look right, maybe he's reading a book or something like that. So to summarize, you look at the O, we're looking for alpha waves. If there is an upward spike, you know his eyes are open. And if there's a downward, eyes are closed. If you can fit an eye in between two things, you know that the patient is looking left or right at that time. So, and there was, so you can see the ECG reading in the bottom, right? This is a pretty normal ECG. You can see the sinus and the university, pretty normal. Also, if there was any stimulation done, like I mentioned, hyperventilation or the photic stimulation, on an EEG, how it would look like is there would be red, like straight lines over here. At the bottom of the ECG, there will be straight lines, and then you look for the activity here, if it's normal or not. So is it clear so far how a normal EEG looks? So looking at the O, eyes open, eyes closed, alpha waves, and beta waves.
After that, it looks like there is an alpha wave, so we probably go to there when it's either close.
See, like there's a follow the storyline. So he opened his eyes are closed, then you see the horizontal movement. So it's actually a bit more complex, and I've simplified this a lot because half an hour is not enough to teach me. It's very right. So that was the first thing, was a normal EEG. This image is of triphasic waves. So let me point it out. Alright, so look at F3. Okay, so F3 is left side or right side. Can you tell me which row it is? 23rd, second. Okay. So just look at this box, which I have somehow tried circle. So you see an upward spike, then it's going down, and again an upward spike. Looks like barriers. So this is known as a triphasic wave. There's an up, a down, and again a down. This type of pattern on an EEG is seen if a patient has like encephalopathy, especially whether it's hepatic or a relieving encephalopathy. So a very uncommon thing. A lot of people think EEGs are only for seizures, but you also can use EEG to diagnose encephalopathy, whether it's hepatic or relieving, any metabolic encephalopathy. You see this triphasic wave patterns in one EEG. Right. So the next pattern I want you guys to know is burst suppression. So if you guys see, it looks very weird. You have a flat line, some spikes, flat line, some spikes, flat line. Now this type of pattern is seen if a patient is very critically ill. So suppose he has a cardiac arrest or any hypoxic brain injury, like maybe he has a stroke, some shock, and he's in very critical condition, like his whole body is in a hypoxic state. Then you see this type of EEG pattern, you know, flat spikes, flat spike. I think it should make sense. If someone's very critically ill, there's not going to be a lot of neuronal firing. He's just almost gone. So this was clear, right? Triphasic waves, you see the up wave, down wave, up wave in encephalopathy, polymetabolic. And you have the burst suppression, critically ill patients, cardiac arrest, or any hypoxic injury. Right, so this is our first foray into seizures. So this is known as the 3-second spike and wave, or I think you guys might have heard of 3 Hertz spike and wave if you guys are in neurology. So what this basically means is that is you're getting 3 spikes and 3 waves in 1 second interval. Just look at this box. This is a 1 second interval. You see a spike, a wave, a spike, a wave, and a spike. So 3 spikes in a 1 second interval. This thing is known as a 3-second spike and wave. And the most common place where you'll see this is going to be someone with absence seizure. So you have a child and his parent is like, this my child looks blank at the wall for some time. Then he just looks normal, he's just confused. You do an ECG and EEG, and then you see this type of pattern. This is an absence seizure. So 3 spikes in a 1 second interval is a spike and wave. Okay, so the fourth pattern is LEDs. So right now it's not known as this is a very old term. Right now it's known as periodic like epileptiform discharges. So what happens here is, so let's look at it here. So here you can see there's a spike, something is normal, again some spikes, normal, again some spikes, normal, some spikes, normal, some spikes. So basically you have spikes, normal, spikes, normal, spikes. So it's very periodic and spiky. This type of pattern is seen in like herpes encephalitis, for example. Although you don't actually use an EEG track for herpes encephalitis, but if you were to do an EEG on these patients, you would see this type of discharge pattern, where you see spikes, a normal thing, and spikes. So just to make the difference clear, between the 3 seconds. With the 3 seconds, you see the spikes are very regular, right? It's 3 in a box. But in this case, it's just 1 spike, then a flat snap, then another spike. It's periodic spikes. I hope this makes sense. Does it make sense? Okay. This is a normal age. This is not abnormal. So, as the box shows, you see something, this is known as a sleep spindle. Yeah, so stage 2. So stage 1 sleep, which way is you guys remember? Yeah, stage 2 is this. Spindle complex, stage 3 theta. So we know that this patient is in stage 2 sleep whenever you see these spindle complexes. These are like completely normal. Last EEG, which I want you guys to know, very important one. Does anyone want to take a guess what this is? Does this look like a normal alpha wave or a normal beta wave or a normal wave? Okay, let's look at this. Here you see normal waves, right? There's no big amplitude, nothing. Your neurons are normal. Now you see something increasing. The amplitude is increasing. Look at the size. Look at this, and then look at this. Look how big it is. And then it goes again to normal. So again, let me just do it again. So it's normal waves. You see the spikes. The spikes are getting taller, wider, and again normal. This is how you diagnose epilepsy on an EEG. So what the term basically means on EEG, it has a clear starting point, the discharge, and an ending point. So again, just look at this. So you